Atrial fibrillation is a form of abnormal heart rhythm where instead of highly regulated signals coming from the sinus node, waves of uncontrolled electrical signals travel through the atria. This causes the atrial muscle fibers to contract out of time with each other, and some of these muscle quivers are passed on to the ventricles, causing an abnormal heartbeat. Abnormal heart rhythms cause blood flow to be irregular. As a result, stasis in the blood flow may cause platelets to stick together, forming blood clots and increasing the patient's risk of stroke. Of the various treatments for atrial fibrillation, Apixaban, commonly known as Eliquis, has been one of the most effective drugs in preventing the formation of blood clots and incidence of stroke in patients. To be able to understand Apixaban's mechanism of action, it's first important to review the clotting process, known as the coagulation cascade. The cascade begins with the connection of the intrinsic and extrinsic pathways, both of which contain the necessary clotting factors for blood coagulation to occur. Initially, inactive factor X, a clotting protein, is converted to its activated version, factor XA. By inhibiting the activated form of the most vital protein in the coagulation cascade, the coagulation cascade is stunted in its most initial stages, conversion of factor X to factor XA. This means that no common pathway is formed at the extrinsic and intrinsic junction, so that fibrin production is never stimulated, and therefore clots cannot form in the body. The clinical trial, referred to as the Aristotle trial, was one of the most prestigious studies conducted for comparing Apixaban and warfarin for patients with atrial fibrillation. It was one of the largest studies conducted in this regard, and the Aristotle trial is referred in a lot of review articles and other studies based on Apixaban and warfarin. The study was to test for rates of major bleeding and the ischemic and hemorrhagic stroke or systemic embolism. The rate for hemorrhagic stroke with Apixaban was 49% lower than the warfarin group, and the rate of ischemic stroke was 8% lower. Results for bleeding or Apixaban occurred for 2.13% of patients and 3.09% for warfarin. Apixaban was proven to have a high percentage of preventing stroke or systemic embolism, less bleeding, and resulted in lower mortality. Warfarin is a traditional choice of therapy and works by inhibition of factor 2, 7, 9, and 10. It is effective at preventing 65% of strokes due to atrial fibrillation. A new generation of medicines called direct-acting oral anticoagulants, to which Apixaban belongs, has been found to be as effective as warfarin in inhibiting factor XA. In the Aristotle study, Apixaban's effectiveness is equal to warfarin, whilst having a significantly lower intracranial hemorrhagic rate. Another added advantage is that it is pharmacologically predictable and does not require regular monitoring of INR. Warfarin costs $53,000 per year, and when comparing cost per quality of life gained, Apixaban provides a 0.5-year survival improvement at a cost of $40,000 per year, making this the more cost-effective option. The cost of Apixaban is likely to decrease over time as the medicine becomes cheaper. The leading comorbidity due to atrial fibrillation is ischemic strokes. Otherwise, atrial fibrillation can be symptomless. Approximately 20% of strokes are due to atrial fibrillation and account for 5% of all causes of death in Australia. The decision for oral anticoagulation medication for prevention of stroke depends on the risk of stroke. The CHADS-2 score is a tool used to assess this risk. Heart Foundation guidelines recommend treatment with anticoagulation is a score greater than 1. For those with a low risk of stroke, a choice not to anticoagulate could also be made. Warfarin is not a benign medication and can cause bleeding complications such as gastrointestinal bleeding, needing hospitalization, and intracranial hemorrhage, which can lead to death. The risk is approximately twofold the baseline risk of 0.1 to 0.3%. Therefore, Apixaban is a superior agent to warfarin with equal effectiveness, lower intracranial bleeding risk, and better cost effectiveness. Apixaban is currently acting as this go-to treatment for atrial fibrillation, with its high efficacy, cost effectiveness, and its lower incidence of adverse effects when compared to other commonly used treatments such as warfarin. Overall, Apixaban significantly improves the lives of patients with atrial fibrillation by treating the condition and providing a significantly safer option of treatment.